Hello, everybody, and welcome back to the show. This episode is brought to you by The Wellness Paradigm, a holistic health coaching company shifting the way that women understand and heal their bodies. Through bioenergetic testing, functional lab testing, and functional nutrition, we uncover what traditional approaches often overlook. So you can stop guessing, start healing, and finally feel like yourself again. No more one size fits all protocols, just real answers, deep rooted healing, and the clarity and confidence you deserve to feel incredible. It's time to shift the paradigm of women's health. Now, on to our show. And good afternoon, Carol.
Thank you. I'm so excited to be here with you and your audience.
Yes, I am too, and this is going to be a fantastic, very much needed conversation around a big topic of breast cancer. But Carol is a naturopath, acupuncturist, and homeopath who helps women recovering from breast cancer reduce treatment side effects, heal emotionally, restore their energy, and really take back their life. And we were chatting a little bit before on how important it is to understand this multi-dimensional healing journey of cancer, and that it's just been a much more common word, unfortunately, in the last, decades. So let's dive into one, who you are, Carol. Tell us a little more about yourself, how you got started in this work.
Well, first of all, thank you for having me again. And I'm really excited to be here because breast cancer is unfortunately increasing. It's almost at an epidemic proportion. It used to be 1 in 8 women. Now it's 1 in 7 women. And women are being diagnosed earlier and in their age. So it used to be like in the 40s, now as early as 32. And we'll talk about that in a minute. But I had graduated from the National College of Naturopathic Medicine. It's no longer called that in Portland, Oregon, in the 80s. And I moved to California and got my acupuncture license. And I had a thriving, holistic, integrative health practice focusing on women's health in Berkeley, California. And I also then was focusing on fertility. And one day I received a phone call and I couldn't understand. I thought it was a crank call. It turned out it was my dear friend screaming on the phone. They found a lump. And that was the beginning of me saying to her, "Don't worry, you won't go through this alone." And I accompanied her through 18 months of treatment at UCSF. And I took care of her in between. So I was afforded an up close and personal experience of what was working in the world of medical oncology and what wasn't. And I'll just give a little example. We were in the infusion room getting IV therapy for her chemotherapy, along with a whole bunch of other women. And in walks the candy cart. So the discord between that is huge. You're giving women chemotherapy to kill cancer cells, but then you're feeding them sugar, which is like putting gas in the cancer gas tank. So medical oncology had no understanding of what is known as the Warburg effect, which talks about how given a choice for cancer cells between oxygen and glucose for the gas tank, it will always choose energy or sugar or glucose, even though it has to work twice as hard. And then her oncologist noticed her blood work one day and said, "What are you doing?" And I told her, and she said, "Well, I'm going to start referring all of my patients to you because this is not the blood work of someone who's had 4 rounds of chemotherapy." And my practice shifted from general women's health and fertility to breast cancer. And then the need outgrew my ability in my clinical practice, and I created an online live group coaching program. And this was about 15 years ago, actually a little bit longer than that now. So I've been doing this quite a while.
Mhm. Yeah, before it was even, online coaching was really
A
kind of,
thing, right?
but it's so important, especially in your field, because people, especially on the coast, you tend to have maybe a little bit more integrative, access, and there's a lot more people that need, that access, especially to people like you. So having an online thing is amazing. Um, so let's kind of backpedal a little bit on a big topic of why we think more and more people are, one, being diagnosed, but two, being diagnosed much, much younger than ever before. Let's unpack this a little bit.
Sure. And I'm going to start with a new television commercial. It's for this product with a woman medical doctor as the spokesperson, and the message is that women should not smell anywhere. And so it's this body spray or something for every part of your body, under your arms, underneath your breasts, in between your legs. and it's filled with toxic estrogen disrupting chemicals, as are all fragrances, body washes, as are dryer sheets and over the counter laundry detergents and shampoos, and the environmental toxins and eating fast out of plastics that have been exposed to heat. All of those chemicals get into your bloodstream and then they sit on the estrogen receptor cell and they prevent the estrogen from being detoxified properly. So the unhealthy, toxic form, carcinogenic form of estrogen is built up in your body and you're not able to excrete it. And that creates inflammation. It creates illnesses such as polycystic ovarian syndrome, endometriosis, fibroids, cystic breasts, and breast cancer. So as our environment becomes more toxic, and let's not forget birth control pills in that list, the the body can't keep up, and the stress in our life adds to this. So women are being diagnosed earlier, and they're called young survivors. And to those of you who are in that age group and or who know someone who is a young survivor, your needs are very specific and they're much different than somebody who's been diagnosed in their 50s or 60s. And you need a very specialized care because your bone health and your reproductive health and all of these issues are at a risk.
Mm. Yeah, I'm glad you brought that up because that is so true, right? You have this fertility, you have this female, whether you want to have kids or not, fertility is, you know, optimizing that is optimizing the rest of your body. But
Right.
um, what are the things that you're seeing primarily with 30 versus we'll just say 50-year-olds as far as not only treatment but recovery?
Well, the 50 and over have different recovery needs than the 30-year-old or the 35-year-old. I mean, the women who are 35, their hormones are being dramatically reduced. They're usually, the options are to take a Lupron shot, which turns off the functioning of the ovaries from messages from the pituitary gland, or have your ovaries removed, and then they're placed on what is known as hormone blocking medication. If
Mhm.
it's Lupron, then they're placed on an aromatase inhibitor and they're put through what I call speedy menopause at the age of 35.
Mhm.
So there's physiological changes to their body, and then there is the emotional changes to what's happening because the hormones directly influence their emotions. And if they wanted to have babies, what is happening with their fertility? So there is oncological gynecology specialty, but I also often work with oncological gynecologists to support women through this whole process from the breast cancer perspective. So, are they going to do fertility before they start chemotherapy, or and then that involves extra hormones? What's going to happen with their breast cancer? It's a very complex question, and it involves several experts working together as a team.
Mm. Yeah, I think cancer in general, it not only an integrative approach, body, mind, soul, but also just multiple different layers, multiple different people. I think it is very, very powerful in this healing journey. So I love that you're one of them.
Thank
Uh,
you.
but I am curious with um, merging more of this integrative field with more of
Mhm.
this very obviously highly medical field. There's obviously there's both sides to this equation. How do you kind of merge the two together?
Well, for me, it's not that difficult because I'm an integrative practitioner in the true sense of the word. That means I believe in taking the best of medical oncology and evidence based, notice that key phrase, integrative holistic tools to support women through all phases of the breast cancer journey. So, the needs of a woman who's been recently diagnosed and about to start treatment are different than somebody who's in the middle of treatment, somebody who has finished treatment, somebody who's on tamoxifen and aromatase inhibitors. So there are several distinct stages of breast cancer, and my approach is evidence based. So when I teach my classes, my slides have references from PubMed on them. And unfortunately, most oncologists are not versed, educated in how integrative healthcare, targeted supplements can actually not just, they don't interfere, but they can actually support their treatments.
Hmm.
There, and how acupuncture, there's been studies how it reduces chemotherapy induced nausea, how using certain supplements and certain approaches can reduce unhealthy weight loss. Known as cancer related cachexia, which can be a number of very big cause of death for women with cancer. So we want to keep women from getting to that place until they're already over the edge, and then it's very difficult to come back. And it's very important to have an advocate for you because, in my experience, there are certain tests that are standard of care, and too often those are not done by medical oncology. For example, there's something called the Caris molecular or intelligence or the NeoGenomics, and these are both standard of care tests, and they're done if a woman has had a recurrence. So there is a biopsy from the second tumor, and that is sent by the pathology department to this one of these CLIA certified labs. And what those labs do, it provides a very extensive genomic printout of what are the driving genomic defects that have created this person's cancer, what chemotherapy are their cells sensitive to, and what clinical trials are they matching up with. So this is very critical information because most often, unfortunately, a woman is given the same chemotherapy as she had with time number one. So this is the definition of insanity, in my opinion, because it didn't work time number one. What makes you think it's going to work time number two? So doesn't it make more sense to find out what chemotherapy your cells are sensitive to because you had a recurrence? Whether it's 2 years later or 15 years later, something is going on. So, unfortunately, this test is not done often enough. It usually is covered by insurance, and it's a very important concept for the women to be able to speak to their oncologists about. The other test that is not done often enough is the breast cancer index test. Now, this test is done as a woman approaches year number 5 of being on hormone blocking therapy, whether that is tamoxifen or an aromatase inhibitor. And what this test does is a biopsy from the sample from the original biopsy is sent to the lab, and it provides DNA statistical evidence of the benefit of a woman remaining on hormone blocking therapy for longer than 5 years. So two things happen. A woman in my group, she was at year 5. Her oncology team had not done this test. After taking my class, she approached them and said, "Hey, I think you forgot to do this." And they reluctantly did it, but it showed that she would not benefit from staying on hormone blocking therapy for longer than she had been on. So that made a huge difference in the quality of her life. The second instance happened where a woman, after taking my class, got her oncologist to do the test reluctantly. And he said to her, "Well, I don't believe the results." And I said to her, "You need to find a new oncologist." Because in the old days, it was the doctors experienced guessing what was the size of the original tumor, what was the Ki-67, which showed how aggressive the cancer was, what are some of the other parameters on the pathology report, and their evidence from years of experience, they would make a quote best guess. But now there's no guessing, it's DNA statistical evidence. So it's not a matter of opinion because you follow the research. So that is where integrative evidence-based care comes in, and that is where evidence research in PubMed, medical oncology needs to utilize that too. And all of that research is being done by medical oncology and pharmaceutical companies. Let's not forget that.
Yeah, it's all very, very interesting. I kind of want to pivot a little bit because
Sure.
integrative is such a big word, right? And I think when a lot of people think integrative, they think I'm going to take supplement versus medication, or maybe both, right? But
Mhm.
it's so much deeper than that. We understand it's mind, it's body, it's soul.
Yeah.
And so when you take this integrative approach, when a client comes in, obviously they're going to be at different stages. Um, I do work with people that have a family history that want to avoid it as well, just out of curiosity.
Prevention, 100%,
Yeah.
100%. It's very important. It's not like, let's just wait and see. I'm not into the just wait and see approach. I'm into let's be proactive. It's very important.
100%. It is always easier to be proactive than reactive, especially with this. But, you know, where would you typically start with maybe a one-on-one client? We'll say that's I'm gonna take it in different steps. That's preventing, wanting to try to prevent this kind of going on in their life. We'll start there, and then maybe if they're coming in being diagnosed.
So if a woman has a family history of ovarian cancer, breast cancer, colon cancer, and pancreatic cancer, people don't realize that there is a relationship with all four of those cancers and breast cancer. Well,
Hmm.
actually three, because one of those was breast cancer. There is a relationship between ovarian and breast. There's a relationship between colon and breast. And there's a relationship between pancreatic cancer and breast cancer, because pancreatic cancer can often be what is known as BRCA2 driven. And the breast cancer BRCA gene, the number two gene, is one of the parameters that can increase the risk of occurrence within a woman. So if there's a family history of those four types of cancers, I think the first thing to do is make sure that the woman has seen and had a genetic evaluation, and her medical doctor can refer her for genetic evaluation. And we take that information. It will be covered by her insurance because of the family history. That's a proactive approach. And then I would do some additional testing. For example, the Dutch hormonal panel is where I always start. This is a urine and saliva test. And what it does is it shows how you are breaking down your hormones. Because when you go to your gynecologist and you get a comprehensive serum blood test of your hormones, it shows where you are in that moment. But the Dutch hormonal panel shows what's happening with your breakdown of your estrogen and what pathway is it going, and is it building up in that red line toward the unhealthy carcinogenic pathway. That's very important to know that, because this is preventive and proactive. If you're going into too much of the estrone, the unhealthy version of estrogen, that is an indication that your phase one and phase two detox mechanisms are not working well, and that there's also too large of a toxic load in your environment, in your body. So we do a deep dive. What body products are you using? What shampoo? Are you using dryer sheets? What are you washing your clothes in? And I mean, all of that. And I'll give a very interesting story. This was a 35-year-old woman came into my office with the diagnosis of unexplained infertility. And I love diagnoses of unexplained anything, because from the integrative point of view or the functional medicine point of view, it means the right testing hasn't been done.
Yeah.
So she had enough perfume for like the Macy's perfume store. And I said, and I had a scent free office, and I said to her, so tell me about scent. And she goes, oh, I love scent. And here's the list. I have the Glade plugins. I have those sticks in oil. I use dryer sheets. And here was the cincher. I use Febreze on my sofa. Now,
Mhm.
Febreze is one of the most toxic chemicals around. So she would Febreze her sofa. She had a dog. The dog would jump up. She'd pet the dog. The Febreze was all over the dog's hair. The dog slept with her and her husband in bed. She'd be on the sofa with her hands. It was a toxic overload moment. So
Mhm.
I'm saying to her, well, I'd like you to go home and take all of the products that you have in your home that you use for cleaning and your body and put them on the counter and take a photo. There were 29 items in that photo. And I
Yeah.
said to her, you don't have unexplained infertility anymore. You have toxic chemical estrogen disruptor overload
Mhm.
fertility. So
Wow.
she took a week off from work. She washed everything in eco laundry detergent. She threw out the dryer sheets. She had to throw out her sofa because we couldn't detoxify it. And she did certain supplements, and she was pregnant in 3 months. She didn't have unexplained infertility. The, gynecologist, obstetrician just didn't understand what was going on. And this is so true.
For sure.
For many people. So in prevention, we want to do a deep dive into all of that. And we also always want to look in at mindset and
Yes.
emotional wellness, because if you're inside of your brain and how you talk to yourself, sometimes that toxicity in your external environment shows up in your internal environment in your brain. And you
Mhm.
can clean up the external environment, but if we're also not bringing in mindset and detox in your mind, and maybe refer you for a therapy or other integrative, holistic, emotional wellness
Mhm.
programs, it's not going to work. The chasm is too big. We need to look at all of those. How you're eating, what are you eating? How do you talk to yourself? What is the talk inside of your brain? How are you sleeping? Are you sleeping well? If you don't sleep well, there's always an underlying inflammatory thing going on in your body, and inflammation creates disease. So, on some levels, it's very easy, but on another level, it's you need to be working with a practitioner who understands those steps. And the other thing I want to say is you don't do all of this in a week.
Yes.
So when I work with somebody preventively, it's, 6 to 8 to 12 week program, depending on what their needs are.
Absolutely. I mean, just the mindset aspect alone could be, 12 weeks.
Several, and
But
can involve multiple practitioners to help somebody, because, we can't do everything ourselves.
no, and that's a crazy thing. I mean, I see it with my bioresonance testing, right? I mean, the impact that the emotional load has on people, I think is being talked about more and more. And there are studies, especially actually as it relates to autoimmune cancer, particularly women,
Yes.
emotions, how they play a factor,
And
processing
stress.
stress. Um, and some of it is deeply embedded, generational too. We don't,
Yeah.
you know. And so I'm glad you kind of bring that up because there's different modalities too. It doesn't have to just be, talk therapy. There's
No, absolutely not. I think bioresonance is important. There's EFT, there's EMDR, there's
that
biofeedback, there's acupuncture, there's a lot.
and different sorts of, energy healers, whatever you believe. But there's so many ways to move this through your body, and that alone, I've seen people's just miraculous recovery from certain things. But there's this huge nutritional element, right? I mean, gosh, we could talk about things like glyphosate and pesticides and all that all day long.
Yes, 100%.
I don't know if you run testing for that, but I guess I would almost 100% say if you ran testing on certain, mycotoxins and toxins, things like that, it would be skyrocketed for every single person that comes in, right? And different products, these estrogen disruptors. I really, particularly for women, the scents, we don't think about, say 29 products, but I would be curious if what were the fragrance in her shampoo and her, and the
The
floor
shampoo was on that
on
table
her,
too. I
you know,
mean, it was beyond, not to mention the cleaning products. So when you walk in that aisle of the regular supermarket and you're assaulted by that smell of the cleaning products and the laundry detergent, we've been brainwashed to say, oh, that's the smell of cleanliness. Ladies, that's the smell of toxic overload. You want to get out of that aisle ASAP, and you want to go to your health food store and you want to buy ego products for your dishes, for the dishwasher, for the hand washing of the dishes. Because think of it, when your hands are hot and you're using that turquoise dishwashing liquid that's supposedly great for grime, all those estrogen disrupting chemicals are getting in your body through your open pores in your
Mm,
hands. So you want to get ego, dishwashing liquid and ego dishwasher liquid. And you don't want to be washing your clothes in those little pods because they have horrible chemicals in them. And when you get out of the shower, your pores are open and you wrap your body in a towel and your body goes and it sucks up all those chemicals into your estrogen pathway.
yeah. I'll also add things that you would, or maybe a little bit more innocuous, like plastic cutting boards.
Oh,
Uh,
yeah.
the plastic in that, or the plastic in the pods in your dishwasher, like,
Yeah. I don't know what to do about that. I just buy powder.
yeah, powder liquid. There actually are pods that are eco-friendly that are not plastic based by like seventh generation.
Yeah, that's what I use.
Yeah. So, if you're really a pod girl, there
But you
are
can
some.
also buy powder. Powder's just as good too, and you just skip the whole plastic. component of it, right?
100%. I had this conversation with the client earlier, but it's like, microplastics are a big problem too. That we just, I think, drinking out of plastic water bottles, right? It's like,
Oh, yeah. Let's talk about spending money when you go to Costco, you buy these big things of plastic water bottles. So let's talk about that. First
oh,
of all, you're spending a lot of money for these plastics, which are not great in the environment, but more important, we don't know how hot those plastic water bottles got in between when it was put into the bottle and when it was transported in those huge trucks and what it was exposed to heat in the warehouse. So when plastic gets exposed to heat, the BPAs and the BSAs leach into the food. So you're
mhm.
spending a lot of money and you're buying these plastic water bottles thinking you're doing something good for yourself, but really every time you drink out of them, you're ingesting the BPAs and the BSAs that got into the water when the plastic was exposed to heat. So what is the solution to this? Buy yourself one of these great eco water filters and have a stainless steel, jar that you bring with you every day that you keep your water in from home and save money.
Oh, so true. That's one of the first things if clients step in, it's like, it's very overwhelming, right? With where to start. Just like you said, you can't do this all at once, but
No,
it's
you
like
have to start with the most important things and go slowly.
about water, filtered
But
water.
water is the
Where do you
most
drink it out
important.
of?
Yeah, that's simple, but sometimes it isn't. It takes people a while to get there, but it is simple to stop drinking out of plastic water bottles.
Yeah.
Save your money, everyone.
Yeah, 100%. I'm glad you brought that up, especially the heating, because that's something I think people maybe
And
are
you,
starting to become familiar with plastics, but not
yeah. And
why.
you keep them in your car,
Yep.
thinking they'll be handy, and then you close the windows and the car's in the parking lot. It gets to be 113 degrees in the car in the summer, and that's it for that water.
Mm-hmm. Yep, 100%. Now, kind of pivoting from prevention to more reactive care, for lack of better words, but say somebody's coming in. I'm sure there's different plans if you're one, two, three, or four, right? But what are kind of the main things that you're starting with if somebody's kind of I guess actively going through treatment or maybe seeking treatment, not sure if it's the right option to go maybe, more of a traditional route, mixed, whatever that looks like for the
Oh,
person.
well, that's a lot of different
I know.
questions there. So let's skip whether they're seeking treatment. Let's assume that they're in treatment and then they need to recover. So in treatment, my job is to make sure they understand their pathology report. That's very important because there's a lot of new words there, and most time they are not explained what's on the pathology report appropriately. It's like showing me a brochure for a Tesla car to fix and expecting me to understand it. I would not be able to do that. So, understanding is very important. And then working through with them what the decisions were and how the oncologist presented it to them, and making sure they feel comfortable and confident that they are choosing this treatment because there's a very different attitude. And lots of times the oncologist will talk to women like this: well, we're putting you on this drug, or we're going to do this treatment for you. Not like, here's what we discovered and here's what is recommended. What do you think about it?
Mm,
Because being told what to do and those original words that the doctor was speaking to the women makes them not an active participant.
mm,
And I think it's very important that you are an active participant because there's a difference in energy between actively deciding and choosing to do treatment ABC versus, well, the doctor told me I need to do this.
absolutely.
So that is a very important distinction right from the beginning. And then there are supplements that are safe to take during chemotherapy. And then it's very easy if a woman's doing an infusion every few weeks, 3 weeks usually, we can just tailor the protocol so that she stops taking certain days, certain supplements 2 or 3 days before the infusion and for 2 or 3 days after. So you're not interfering with the infusion because that's very important. And it's important to work with a practitioner who respects chemotherapy and radiation and understands when to and when not to, and which supplements are okay and which are not. For example, you never want to do vitamin E during radiation or any form of antioxidants. And there are studies that show that. So I'm very, very careful. There are ways to support a woman during radiation in which you are not using any antioxidants, but you are supporting her to the best of your integrative ability. And of course, she always needs to speak with her doctor about that.
Yeah, absolutely. I'm curious on if you have thoughts on vitamin infusions like C or mistletoe.
Oh, I recommend mistletoe a lot.
Mhm.
And I always recommend they have an experienced practitioner who's been certified through the anthroposophic medicine program of Dr. Nasha Winters. So yes, I think mistletoe is very important. And for those out there who don't know what it is, mistletoe is a parasitic plant. And unlike a lot of parasitic plants, it doesn't kill the host. And so it takes on the qualities of the host tree. And mistletoe is very big in Europe. They use it extensively for immune illness and cancer. But it's not big here. And why is that? Because it's not a big pharma product. It has to be the tincture has to be imported from the Oriel pharmacy in Germany. And it's only because the FDA is allowing that it can continue. And it can be given as an IV, or you can have your mistletoe doctor teach you how to inject it into yourself at a very specific angle. And you want to get an immune response. And what it does is it activates natural killer cells, it activates your immune response, and it can keep you much more healthy during treatment than if you're not. It reduces treatment side effects, it increases your longevity, it supports your bone health. It's an amazing product.
Yeah, that's something I wish was more one widely talked about as an option, and two, it's not going to be something covered by insurance, but it would be
No,
so.
it's not. You need to be able to pay for it out of pocket, which eliminates a lot of people, unfortunately.
Yeah, yeah, IV infusions are beautiful, but they come at an investment. But um, you talked a little bit about acupuncture. There's the potential mind therapies and things like that. Are there some other treatments or suggestions you have if somebody's going through treatment to kind of mitigate the side effects?
Well, I think the biomat is a very important aspect of that. I think energy healing is important, bioresonance is important, and these are protocols that you don't need to be concerned that they're going to interfere with your treatment. Energy healing is not going to interfere. Homeopathic medicine, I'm also a homeopath. I use that in my practice a lot. And the beauty of homeopathy is there's no live molecular product, so you don't need to worry about it interfering in any level with your medical oncology treatments. It just supports your whole being wellness.
Yeah, homeopathy is beautiful. I mean, bring back the homeopathic hospitals that used to be here.
I know that when I grew up in Philadelphia, and Hahnemann Hospital was a homeopathic hospital until it was taken over by the medical world in the 1900s, unfortunately.
Yeah, yeah, but I love that you can integrate those together too, because I'm sure also post treatment as well, which I kind of just want to briefly tap on, are what are some things besides the the basics preventative while you're doing it, all of that is still going to apply. But are there specific things that, you really watch for, certain things that you really want to, pay attention to post?
So I think post-treatment is one of the most important aspects because the treatment area has a start and a stop date. So a woman can know, okay, I'm starting day A, I'm going through this for 18 months, I'll be done day B. But post treatment, it's a whole woman's life. And one woman said to me, I know this sounds strange, but I actually liked going to radiation because I felt like I was doing something. And so you're so active in treatment, you go to radiation, you're active with the doctors, and then you ring the bell and you're handed a prescription for tamoxifen or aromatase inhibitor, and you're told, bye, see you in 3 to 6 months. And the woman is left with a devastated landscape, emotionally, psychologically, spiritually, and physically. There's body changes. They've had surgeries. They don't recognize their breasts and their bodies anymore. That creates emotional difficulties with their marriage. Women who've had breast cancer have a much higher divorce rate. And their energy is not what it was. And the problem is, people in their life think, oh, great, she's done through treatment. We don't need to help her anymore. She's going to get back to her regular self. And unfortunately, that is not the case. Physically, there is no way that she can feel well because of all those treatments that she's been on. The energy stacks up and conglomerates. And then she's placed on one of these hormone blocking medications, and that's when the difficulties really start. So there's an increased risk of suicide on tamoxifen. There's an increased risk of cognitive decline. Aromatase inhibitors are well known to impact bone health, which is a serious problem. And they're looking at the rest of their life and they're thinking, how am I going to go on like this? And so a lot of my program, Empowered Against Recurrence, focuses on this area because we need to detoxify from the treatments, rebuild your body, and then create plans for long-term wellness moving forward.
Yes. Yes. I'm so glad you mentioned that because I feel like it's like you go through all this and then it's like, okay, bye, you're done. And it's a beautiful moment where like, yay,
Yay.
but then you feel lost.
But what happens next,
Yeah.
right?
And probably fearful, right? Like what happens?
A lot of fear, and you can't live in fear. It makes anxiety, that makes inflammation, that makes you unhappy.
100%. I think kind of to wrap things up, if you, this is a big question, but if you could give one, two, maybe three little pieces of advice for somebody that's, maybe wanting to support somebody going through this, maybe they're going through it and they're just feeling overwhelmed, what would you tell them?
Healing is always possible.
Mhm.
It's never too late to enter the path of integrative, evidence-based holistic care. It's actually very beneficial. And you need to find a practitioner who has an integrative oncology experience because there are a lot of functional medicine and naturopathic doctors, and unless they've had specific integrative oncology, this is a specialty. Like you wouldn't go to an orthopedist to deliver a baby. You want to go to a specialist who really understands what is integrative oncology, what are the medicines you're receiving, what are the emotional and physiological needs that you need now, and how can they best support you.
Yes, yes, love that. Well, if people wanted to find you, connect with you, please let us know where they can.
The easiest place is through my website, which is my name, Carol Lourie, and that's spelled Lourie.com. And there's a contact me form on the top of the website, and I answer everyone's request personally.
Oh, beautiful. I will definitely link her website below as well as her social media if you want to go, find her there. I believe you also have a little freebie that I will attach as well.
Yes, I'm excited. It's called my Healing Smoothie. It's a proprietary combination of specific ingredients that are anti-inflammatory, pro-health. Whether you have cancer or not, this is appropriate for everyone. And it tastes delicious.
Bonus. Thank you. Well, I will definitely put that down there as well. And thank you so much for being here. And I would absolutely love it if you guys found this helpful. Reach out to Carol, reach out to me. We'd love to hear some feedback. But also share this with somebody if you know that they might benefit. I know there's probably, unfortunately, some people in our lives that we could share this with. That could
Everyone knows someone who's had breast cancer. It's unfortunately the reality, and I'm here to help with that.
beautiful, beautiful. Well, thank you for being here. Thank you for listening, and we will catch you guys on the next show. Thank you, Carol.
Thank you so much.